Hey guys, it's Amy. Today I wanted to make a video about gastric sleeve surgery. I recently had it. As a lot of you guys know, if you guys watch my videos, I talk about it, I give updates about it. I'm less than 3 months and I've lost 45 pounds from the last time I weighed myself, which was around my birthday. So this video is just to clear up the well-known saying, or the well-known, what people say or what people think about it. And that is, it is the easy way out. Okay. No. Just no. It's easier than doing it on your own, yeah, I guess. But, well, you see, that's the misconception. See, gastric sleeve surgery is just like dieting and exercising. The only thing is they take out a little bit of your stomach, or a lot of it. So, I guess the best way to describe it, is faster. It is the fastest way to lose weight. It's a good way to put it. Yeah, it's very fast. And depending on what else you do, it can be extremely faster. But the issue with this, and this is a big issue, is that a lot of people think fast means easy. No. See, gastric sleeve surgery takes out 75 to 85, sometimes more depending on where you're going, % of the stomach. That means that they're taking out more than half your stomach. Gastric sleeve also removes the thing that makes your stomach stretch. It also takes out a hormone that makes you hungry. Now, for R&Y patients, it's a little different. They take out your whole stomach and they make a little pouch out of your intestines, I think, and then they switch everything up. And the only issue with that is malabsorption. Malabsorption? I totally messed this up. But you guys know what I mean. It means that you're not getting all the nutrition in. Your body is not able to absorb all of the nutrition. And it's also not able to absorb all the calories. That's why most people who have the R&Y lose a lot faster than people who have the sleeve. Sleeves are known for slower results. If not the same, they're the same, but they're just a little slower. Now, why do I say it's just like exercising and dieting? Well, it helps increase the weight loss to exercise. And because we're forced to eat so little, well, yeah, it's kind of like a diet. But the thing about this is people think, well, you can still eat everything. No. See, that wouldn't work. For most R&Y patients, they have what is called, or commonly known as, the dumping syndrome. Dumping syndrome is when they eat something with too much sugar, or if they eat too much starch even, they get something that makes them really, really sick. It makes them dry heave, if not throw up. It causes them pain, some shake. It's a huge discomfort, gives them heart palpitations. If you guys don't know what that means, it increases your heart rate. You can feel your heart beating out of your chest. Think of it kind of like drinking too many cups of coffee in that sense. This is why it's not known for people to be able to eat everything. Well, what about sleeves? Sleeves can't eat sugar either. It's recommended by doctors that we don't eat sugar. Why? Well, we have to save all that room for protein. But also, it's just not good for us. What else? We have to cut out fat. And the reasons that we have to cut out fat is because our stomach processes food a little bit differently. So things with a lot of fat are going to make us very sick. And by what I mean by that is diarrhea. It's like eating something, like eating a hot dog with 13 grams of fat will give us the same effect as eating a whole bunch of Taco Bell. And if you guys know, the Taco Bell is known for their Taco Bell shits, and that's terrible. So, yeah, so it's not like we can eat the same things, and most of the time, the little bit of time that we get to eat, it has to be protein. Why protein? Well, protein helps with hair growth, it helps with recovery, it helps your body work. Yeah, protein's really important. That's how I grow my nails so long. Thank you, protein. So what else? Just had something on the tip of my brain. Okay, so what about exercise? Well, Amy, what about exercise? Exercising, it speeds up weight loss, but you're still going to lose, so why is it important? Well, for the next couple of months, you have to worry about blood clots, so you have to get up and walk. And then after that, you start getting loose skin the more that you lose weight. So what tones out the skin is toning your muscles. You got to tone and shape your body. So working out and exercising helps with that. Also drinking lots of water, which is really difficult to do when you have a very small stomach. Why? You can't gulp water. I did that once when my poor friends came to visit me, and I gulped water without really thinking about it, and it came back up because there's not very much room for it to go, except back up. Of course, it didn't come up to the point where it's projectile vomiting water all over the place. What else about diets that you have to change is if you're a soda drinker, you can't drink soda. Why? Well, soda is carbonated, and carbonation is gas. And when you put that into your stomach, it expands your stomach, which doesn't happen with the sleeve. So it just causes you a lot of pain. Yeah. So you have to cut out soda. You can't drink as much caffeine as before because you have to get all your water in. So if you're gonna have a coffee, you either have to make it decaf or you gotta make it count by drinking a whole bunch of water, which unfortunately you don't do enough. And I was just thinking about something else. Oh yeah, right. So, okay, so it's like normal dying. What else? Well, because we're eating so little, we don't have enough vitamins. We're not taking enough vitamins. So what do we have to do? We have to take extra vitamins. We have to take calcium chews. We have to take chewable vitamins, or you can take normal. I hear the further the way out. Yeah. I have to take B12. Now, I'm not like my mom, who has to take so much more than me, because she had the RNY, and I had the sleeve. But, yeah, I've never had to take vitamins every day in my entire life, and now I do. I also never had something called GERD, or acid reflux, when your stomach acid pours out into your throat. Well, my stomach's still producing the same amount of acid it would if I had my full stomach. 75 to 85% of my stomach is missing. It's gone. So it's producing 75 to 85% extra stomach acid. So what happens? It's coming up. It has nowhere else to go. Normally, milk, that will calm it, coat your stomach. But a lot of the times, you either gotta tough it out, you gotta take medicine. You have a 20% chance after surgery of suffering from gallstones. So you have to take that. Yeah, this isn't easy. It's easier than if you would have to do this alone, except there are so many changes to your health that you really have to think about. And not to mention that the weight loss is a lot faster, that you're constantly in need of new clothing. Since I'm in the beginning, I haven't really struggled with this, but there are a couple of, I've gone down about a size, and I have plenty of clothes. It's hard to explain. Some, okay, I guess I've gone down 2 sizes, but not all. I guess I can say it, 2X's fit. Not all 2X's fit, but all my 3X's fit, and all my 4X's that I wore are now too loose. And of course, I'm losing my weight up top because I'm apple shaped, and I'm always going to have a rounder bottom than I am a top, and so I'm losing my chest area. So the shirt might fit comfortably around my midsection, but I'm giving everyone a show, which is not cool. Then you have to deal with the emotional things, because people who are dieting can probably have a cookie every once in a while to calm their thoughts, but unfortunately we can't do that, and so we have to find outlets of how to control that emotion. Therapy is involved. A lot of people who've had the surgery have therapists now, so that they can deal with the emotions without eating. OA is a big factor. I go to OA. I love it. I think it's a big help. It has plenty of tools to add on to this tool. So you have to deal with the emotional issues. And then you also have to deal with other people around you. Why am I shaking? My hand was shaking for a while there. I don't know what's going on with my body. It's completely different. And then you have to deal with all the criticism of, oh, you took the easy way out, or, I don't think you made the right decision. I had a friend the day before my surgery tell me that he was afraid for me and didn't want me to get the surgery the day before, and I told him he was setting fears, and we're up better now, but yeah, there's a lot more hate, because if you're telling people that I'm now going to the gym or I'm on a diet, people are not going to be like, I don't think that's good. No. I guess people are afraid because it comes with such a high risk of dying. That's how that works. Another reason that the surgery isn't the easiest thing in the world. Like I said, it's easier, but it's not easy. Before surgery, some places, or most places, have you stop eating. They have you go on a liquid diet. For me, it was 10 days. For some people, it's 2 weeks. For some people, it's 1 week. People are different. Someone did it for 4 days. People are very different. Doctors are very different. So you have to go on a liquid diet for about 10 days. And then you have your surgery, which is huge. Like, I've never had a surgery before, and I remember having multiple panic attacks. And I'm not one of those people that have a lot of panic attacks. That just kind of happens. Yeah, so it's a big emotional issue, since you can't use food to comfort yourself in those times of need. And then, afterwards, you can't eat, of course, because you just had major surgery on this thing that digests food. You can't eat, so you're on a week of liquid, 2 to 3 weeks of full liquid, a week of pureed foods, which is kind of baby food consistency, then soft foods, and then you're introducing normal food back very slowly. And there are a lot of times you get sick. I've gotten sick a lot. Either you're eating too much, or you're eating too fast, or you didn't chew something right. You can get sick for a lot of reasons. The foods that sometimes there are no real explanations for it, except your new stomach, or mine, as I like to call her, Eve the Sleeve, doesn't like what you're eating. I can't eat bread unless it's toasted, or flatbread, or a tortilla. I can eat that, but I can't eat normal bread. Couldn't eat eggs for the longest time, and now I can only eat very little. Cereal you can't eat, so if you're a big cereal eater. you can put protein powder in mashed potatoes. Depending on where you get them, they're decent, but you pretty much stay away from starch. So you pretty much can find out only eating protein. Now, if you guys know what protein is, it's beans. You can get protein from beans. You can get protein from meats and cheese and milk. But unfortunately, sometimes Eve the Sleeve doesn't like some things. Chicken's too dense. No, thank you. Pork chops, depending on how they're cooked. Sure. Steak. She loves steak. Fish, sometimes. Yeah. So your stomach is getting so used to everything. And for some reason, your taste buds change. It's something to do with hormones. Your taste buds change. So the things that you liked before, you might not like now. So let's say you're told to eat chicken, but you hate chicken now, and you can't deal with it. Also, tuna fish. I love tuna fish. Can't eat all the mayonnaise that's in tuna because it's too fatty. So yeah. So yeah, big differences. Big differences. It's not easy making those life changes in a short amount of time that you had to prepare. Not to mention all the tests that you have to take, all the new doctor's appointments. Like I said in a different video, I went to the doctor today. It's for my 3-month appointment. I had to get blood taken. They poked me 3 times because I wouldn't let them go any further. Used to be 6. Then I just quit that because that's fucking insane. I've always been a tough prick. Right. I've always been a tough stick. There we go. That was it. Sorry about that. I've always been a tough stick. And I'm an even tougher stick now because I'm not getting enough water in, so I'm dehydrated. They poked me 3 times, couldn't get any blood. I don't know what I'm going to tell my doctor, but it's not going to be great. That was an issue. They can't get blood out of me. I've been poked several times, and they can't do it. When I was in the hospital, I was poked 6 times. And then the nurse brought my doctor in, my surgeon. Heavenly saint surgeon. I'm so grateful. He got it on 1 stick. He's so amazing. I'm so grateful for that doctor. I'm so grateful for my surgeon. Unfortunately, though, he's not always going to be around, and it didn't go well today. And to know that I'm probably going to have to take those tests again soon. I hate needles. Used to be perfectly okay with getting my blood taken. Used to be okay getting needles poked into me. But when I went in today, my sister will test for, is a witness. So she'll definitely tell you that I was shaking. I was squeezing her hand. I hated it. I hate needles now. Didn't hate them before. Hate them now. So there's another thing that changed. When I think about, when people think, well, this will all be worth it, all this big change for a big amount of weight loss will all be worth it. Yeah, but right now I'm not seeing a lot of results because it's so soon. And unfortunately, this is when all those changes are new, and this is when you need to see results. And then again, when you get on the scale, it shows you. That's why people get on the scale every day, because it shows them, oh, I'm doing well. But I can't do that because sometimes that scale doesn't move, and that drives me insane. Yeah, people are different. But my point is, when people try to say this was the easy way out, or this was such an extreme way out, I know. It's not easy. When people say it's such an extreme way out, and I'm like, I know, but it's my only way out. It was my only way. And people don't understand when I say I've tried a lot of things, almost everything. Everything that I could without spending money. I went to the gym and I exercised. I saw a nutritionist. Did OA for a while. Did this Slim Fast shakes, which really didn't do anything. They felt like a snack. They felt like something that you would use with a meal. Like a milkshake with your McDonald's Happy Meal or something. Yeah. They just weren't taking the spot. And then I've done Weight Watchers, which was very unsuccessful. Because they pretty much tell you can eat anything you want. And that's not how diets work. Because if you could eat anything you want and lose weight and not overeat it, then I don't think you'd be overweight. But yeah. So that was a huge misconception about how easy this is, because it's not easy. Like I said, easier and quicker than doing this on my own, but not easy. A lot of life changes. A lot of times you need to be prepared. Cover your ears. Just a lot of things. So I hope that this might clear up any misinformation. Pepper, stop. Pepper. Oh, did you hear that? Okay, so thanks for watching. There's a way to end this video. Okay, bye.